Hello, everyone, and welcome to our knowledge and learning session. This is a weekly thing that we present every Thursday, and joining me is my colleague Paul Calori. So, Paul, welcome.
Thanks, Mark. And how are you today?
I'm doing fine. So, Paul, this week the focus has been, and some of our viewers and listeners would know, this week has been all about the safe use of cannabis. So leading into this week, I hit on some of those topics. And today, part of the safe use of cannabis would be cannabis and driving. So cannabis use and driving is something that, it pops up fairly regularly, whether it be with our clients or even bumping into someone and they recognize, the kind of work that we do. It's not unusual for that question to be raised because either just for general knowledge or they're really looking to see how much can I take and still not get caught. That's usually the first one, even ahead of, and it's not a laughing matter, but ahead of how much can I consume and still be safe. So, Paul, your comments on that?
We'll definitely address those exact topics as time goes on. When I first thought about this section, what we were going to talk about, it was very unifocused on cannabis and driving. And I thought, in previous conversations we've had, and we'll share with that in just a moment, but in previous conversations we've had, one thing that does not work if you're approaching a message of safe use of cannabis and the exclusion of driving is just hammering it in. And I couldn't imagine doing it for 5 days in a row or you speaking to the audience for 5 or 6 days about don't drive, don't drive, don't drive. I think the message becomes lost pretty fast. No one wants to be lectured to. So we kind of morph that into more a safe use of cannabis. And I know you've been talking some low-risk cannabis use guidelines and some documents that like that exist right from the government. But yeah, we're going to definitely tackle some of cannabis and driving today, and in the context that you said. Before we get there, though, let's talk our manifesto as we always do, and where we find cannabis and driving in so far as our path to be well. So our manifesto today is: I know cannabis is my medicine. It helps me. And having said that, just because it's your medicine, and you would have touched on this week, you need to use it responsibly. And this does not just apply to cannabis specifically, but it could be how opiates affect you, sleeping pills affect you, some antidepressants and those types of medicine, and how they affect you and the things that you do around. So, we're relating it to cannabis specifically, but there is a large group of medications that can alter, we'll say, your mental function, your physical function, and you want to be aware of how you use it, even though it is your medicine. Cannabis and driving we find in our be progressing, so stage of our path to be well. And be progressing is, when we start implementing cannabis use, our launch phase, if you will. Everything before was pre-launch. This is our launch phase, and we're using cannabis. That's why we find it here. And I'm committed to my health goals, working on small wins that contribute to my treatment plan. Daily, I see progress by testing and refining while journaling my results. And so that's be progressing in a nutshell. So having said all that, I've kind of touched on a previous discussion. Podcast.weedwell.com is where you can find this previous discussion. Andrew Murray, President and CEO of MAD Canada, joined us in December. It's podcast episode number 9. Now, he shared with us some wonderful tidbits of knowledge and information, and I don't want to just rehash that. I do recommend, if you're listening or come across this or watching now or come across this and listening later, go back to that episode if you really want the we'll say meat and potatoes of some of the things that you discussed. But we will touch on that. And that's episode 9. You can find that at podcast.weedwell.com. Long-winded intro there. But onto the driving part. Okay, so you talk in the clinical setting, and not everyone. So it's not a blanket statement, but often it's kind of asked in the context of how do I skirt by the authorities and not get caught. I think is kind of how you worded it, and we've all heard that question. Mm-hmm. And I like to reframe it as how do I use it safely so I don't have to worry about the authorities and I won't get caught. Mm-hmm. And so this is why, we really morphed into low risk or minimal risk use of cannabis guidelines and stuff like that. And so when you frame it like that, your mind automatically goes away from, I'm not worried about the roadside sobriety checkpoint or the ride program in Ontario because I have nothing to worry about. I haven't done anything wrong. I'm using it as I'm supposed to use it. So while there's no hard and fast rule, often you'll see in literature waiting 6 hours. Now, this is after consumption of inhaling cannabis. This will not apply to your dosing underneath your tongue. It will not apply to if you eat a brownie or take a capsule in an edible form. But that's a guideline. The trump card to that, if you will, is if you don't feel right, if you don't feel sober, don't drive. And to bring up a point that Andrew brought up, and I thought this was fantastic, is the simplest way to avoid worrying about checkpoints or the law, don't mix the two activities. Don't mix cannabis use, we're talking THC, of course, with driving. And that's the simplest way to not worry about the authorities.
Yeah, very good, Paul. And I couldn't agree with you more. And Andrew's comment about that. It's common sense and it's maturity and it's logic. If you're planning on driving, just don't consume. It's really that simple. Why put that risk and burden on yourself or perhaps even someone else?
Yeah, it still exists, and even more recent studies still will show. And Andrew really focused on this category, the age group of 16 to 30-year-old, especially male. But you still see stats of 1 in 4, 1 in 5 that have recently, and the timeline varies when I say recently, once in the last 6 months up to once in the last year, but 1 in 4, 1 in 5 have driven or been in a car with someone who's high while they've been driving. So it still exists as an issue. If we had Andrew here and some of the authorities, they'd still want to address that issue from a safety standpoint. But the other thing that became clear in that interview, with legalization specifically in Canada since 2018, there hasn't been this morph and blow up of car accidents and injuries and deaths. And so what I recall from that interview was it was largely what people were supposed to be doing and the authorities supposed to be doing. That happened, and he seemed to be complimentary to that. So there's a lot of good things happening as well. It's not all gloom and doom and don't do or anything like that.
Yeah, exactly.
So one of the things that comes up, and you get more vague answers, and I've already given you a vague answer. I've used the 6 hour as the inhalation general rule. But it really is a general rule. Here's the thing. For the longest time, for alcohol, you can pretty closely figure out your rate of excretion as your alcohol peaks and then it begins to come down. And you can figure it out by number of drinks, type of drink, gender, and then measuring the time along, right? And you come to a pretty good conclusion of when, in theory, you would go under the legal limit or be sober, completely sober. Unfortunately, it doesn't work with cannabis, and there's way too many X factors. I think people have become accustomed to, if you wait this long, relatively speaking, you'll be okay. It doesn't work that way for cannabis. And so you bring in harder factors to measure experience of user. type of cannabis consumed, not CBD to THC, but more percentage of THC. How much consumed? How was it consumed? And there's a lot of factors there that 6 hours just does it's a guideline at best. It's not a hard and fast rule. What we do know with cannabis use is when you inhale, it lasts in your system a lot shorter amount of time than if you take it underneath your tongue or if you're eating a brownie or an edible like that. That we do know. And so,
Paul, if I can just elaborate
yeah.
to that point, because I really want to ensure that we drive that home. You've already done a good job. Maybe our listeners hearing it from a different voice, it'll sink in a little bit deeper. I don't know, but I think it's worthy of doing this. And it's about the 6 hours that you've referred twice now. And that really relates to inhalation. Even with that, there's factors, the potency of what you're smoking and how are you really taking it in. There's a whole slew with that alone. But then you've also touched on, applying drops of oil under your tongue or edibles. In some of those cases, it can take an hour and a half before it even takes effect. So you can see where you're chipping away at the 6 hours pretty quick. And we also know that, at the rate that it metabolizes in the system and it can last 6-7 hours beyond that initial, intake time. So you're well over that 6 hours alone. And again, this is just in general terms. There's so many other factors that contribute to it. Going back to the best and most impactful point above all is if you are planning on driving at some point in the near future, meaning hours, just don't consume. Leave it for later and avoid all of that guesswork and potential risks and hazard associated with it.
For sure. So, we'll kind of continue along that way. And if you meet the ride checkpoint, if you will, or if you're just stopped for whatever reason, and we're often asked sometimes saliva tests, blood tests, and what have you, and what has become pretty clear. And, much of my information right now, I'll plug mad.ca. There's a wonderful section on cannabis and driving, mad.ca, right in your top bar there. And you can find cannabis and driving. And there's a lot of information and stats and things that they're working on for learning and knowledge programs right from teenage group. But with regards to that, the saliva test is set so high. What will be asked is, I use my cannabis daily. I'm going to fail the test because it's going to be there. It stays in the system, et cetera, et cetera. And my understanding is it's set so high that the trace amounts that might be in your system from yesterday's use or earlier, much earlier in the day use isn't what's going to trigger a positive test. Andrew seemed to indicate that because they're set so high, you're going to be quite stoned, and that's the type that it's or the amount that it's going to pick up as being a positive test. It's not going to be the trace or latent amounts that are left in your system well after use. He did mention one of the things, though, that after that occurs, the blood test is still there that you would, if you somehow got high enough to pass the positive on the saliva test, the blood test is, if you're using it properly, is what's going to clear you or keep you out of trouble with the law. The other thing that exists are drug recognition experts, and those are the people that are trained in watching body responses too. Most often, if on these police shows and type thing, they're looking for alcohol, but they're recognition experts for various drugs, including cannabis as well. And so there's any number of tests that they're not all set to get you. If you're doing what you're supposed to do, you're going to be fine and you're going to pass those tests, and there won't be issue that wise. But again, that's if you're doing what you're supposed to be doing and some of the things that we've already talked about.
Paul, catch your breath, have a little sip of water. I just want to remind our listeners that the information that we're sharing with you here is totally in general terms. They're not necessarily scientific driven or even legal information that we're giving you. This is strictly in general terms that we're giving you what we have heard from a reliable source. MAD is an authority in that space, not only across Canada, but in other parts of our continent and the world. So we're sharing that information with you. And as Paul said, if you would like to hear more or know more, two options, podcast.weedwell.com, episode number 9, you will hear that interview that we had with the CEO of MAD, which is Mothers Against Drunk Driving, by the way, Andrew Murray, who done an amazing job. And Andrew has been around for many, many years, so he really knows his stuff. The other source that Paul already touched on is mad.ca. That's their website. And mad is madd.ca. Go there, and right on the top banner, you'll see, where you can click on exactly that topic. And there's an immense amount of information in there.
For sure. So I think, really that covers the large parts of cannabis and driving that we really wanted to talk about. Few things that you've probably touched on during the week that I'd like to, recap as well. Important things. And I remember this in the clinic to some extent, and I'll address it. And it was the idea of THC percentage. And I think for some, not all, they get focused on the number. And if hypothetically an 18% THC product of whatever name did me well, 20% is going to do me better, or 22% if that happens to be available. And I just want to point out to people, it's not the number, the percentage. It measures potency and that, but more isn't necessarily better, as in a higher number isn't necessarily better. Much the same, I've used this analogy sometime before about your washing machine. If a little soap cleans your clothes, you don't need more soap. And so we've often at Weedwell said, if I had to sum it up in one concept, less is more. And so if you find that strain, more importantly, that type of strain that is providing some relief, and using the THC percentage as an example, it's 18%. You don't need to jump the 20% to find more relief. It just might be how you're using that strain or when you're using that strain during the day. Because the 20% strain might be a completely, we'll say, different family, if you will, for simplicity's sake, and it might have the opposite effect of where you were. And so I just want to point out one of the things that you'll see in the low-risk cannabis use is where you can use THC, as low THC percentage as you can, or something with CBD in it. And that's more to mitigate the negative effects, the high feeling or the paranoias that might come with THC. And so I just wanted to bring that forward. Less is more. And where you find something that's working, you don't have to step it up and continually step it up and continually step it up.
Mm-hmm. Paul, you and I touched on this, and I'm going to go out here on a whim, but only because we hear this a lot. And I'd like to bring it up so that we could add a different layer to it. And I've heard, a fairly large amount of times that I'm okay to consume because I'm more alert when I consume, as far as driving or even doing other activities as well. And that was raised when we were talking to Andrew Murray from MAD, because it is fairly common. And his response was pretty quick. That is a myth. Mm-hmm. That is not supported in any way. And I know that you have something to add to that, Paul.
Yeah. So where I recall the conversation went is, you can argue whether you're more or less alert driving down the road, we'll say going in a straight line. What I recall about the conversation is the problem with this, and especially this meaning THC, okay, and especially in conjunction with alcohol use, is the delayed reaction time. And so it's not the driving down the road, and I'm not saying that's okay at all. It's the kid running out in front of your car and having the proper reaction time and the proper faculties to react to get out of the way. That's a very specific example, but anything that requires a quick think, an adjustment on the run seems to be where the issues are, because the reaction time is what's slowed, and you see that with the THC, but as well as alcohol, and that's why I say it's even more profound in conjunction with.
Yeah, good job. Answering that one there, Paul, because I just think that our audience, someone in our audience, needs to hear that. And if it's not for you, by all means, now you're better equipped to respond to someone who brings that up. In a setting, perhaps at a social place, and the individual is going to say, yeah, you can hop in with me. I'm perfectly fine. I drive better when I've used cannabis or other drugs, really. So this is a good response, and I particularly like that.
Yeah. So, we talk about, and I've already, just with that last answer, talk about mixing substances. And so, alcohol being one of the more common ones that we see. There's actually penalties and you can see right on the mad.ca website, there's actually penalties that include presence of alcohol and or other drugs in addition to THC with the saliva test or the bud test that I spoke of. And so when we start combining risky behaviors, you actually see how the penalty changes. And as I said, for the viewers or for the listeners, mad.ca, you can see the exact penalties there, and they actually list it by jurisdiction. Of course, this is specific to Canada. I'm going to guess safely that the U.S. and other jurisdictions have penalties about the same, because it's not like the jurisdictions aren't working with each other. Everyone tries to figure out what works best in one area and apply it to their area. So I think it's safe to say that they would be similar, if not pretty close to the exact same. So just a quick blurb on when we're talking about the driving, but the mixing of substances or using substances in conjunction with the THC. So I think, we've touched on a lot of the main points with cannabis use. I don't know how many listeners are in the young category, if you will, today. But if you're here, I'm going to give one for you too, just to include you as well. And this is the idea of brain development and cannabis use, especially specific to THC. And, the brain development, we know, continues up to about the age of 25. And I understand that the substance is legal for you in most jurisdictions where it's legal, well under the age of 25. But what you'll see in the low risk cannabis use guidelines is try to delay as much as possible till you reach that 25, and it's just brain development, possibility of development of psychosis, things like really negative things that if you don't need it, stay away from it.
Mm-hmm. Yeah. So, Paul, one day this week, on the topic of safe use of cannabis, and one of your opening lines is, even if you use cannabis for medical purposes, so it is your medicine, you need to really consider closely how much of it that you consume, and it could be that you start, at that reasonable amount or level and frequency of use, but it could be that over time you start to consume more, looking to feel better, and you've touched on that already. So without repeating that. So part of using it safely is using it wisely and not continue to add more to your daily consumption or frequency of consumption, because it's not necessarily going to give you better results. You may need to look at other underlying conditions or reasons why it's not working the way you would think or hope. And the risk with that, Paul, as I know, and you can elaborate, is you could end up with a possibility of cannabis use disorder over time, or even becoming dependent on the cannabis, where it started with all the good reasons, all the right intentions, but gradually over time, you could end up in an area that's not desirable, and even perhaps even in some ways more negative than when you first started. Paul.
Yeah. So we definitely had a whole discussion about cannabis use disorder. And it's we'll say a few steps down the road. But you point out correctly, tolerance does develop, and dependence can develop as well. Where I recall that conversation went, as opposed to, again, just defining it, it becomes important for you to evaluate your reasons for using, how you're using, why you're using, and whatnot. And if something was effective at one point, and this is when we work in things like SMART goals and treatment plans and titration, and this is kind of your three things that you're trying to keep in mind. Your goal is where you're aiming towards somewhere in the future. If you start going zigzaggy off the path, then you start to question what it is that you're doing. There's your treatment plan and or your titration. So that's titration is the increasing or the altering of the dose. Well, if things aren't getting better by altering the dose, then you probably should alter the treatment plan. And so it's not throw more and more and more. The reality is, for a lot of people, that becomes a non-starter because it comes too expensive. Mm-hmm. Just throwing more and more cannabis at the problem. And so this is when we go back, keep your SMART goal in mind, that future goal in mind, but adjust the treatment plan. And so, as opposed to defining and going all down cannabis use disorder path, as you brought up, a very real issue that we discussed, start looking at it from things that I can do and adjust the treatment plan. And so, using the example of the 18% that used to work, maybe it does become a different percent, a higher percent. Maybe it becomes a different strain that you try. Maybe it's a different terpene in the strain that you try, like where you become less focused on what the number is. But and that's the alteration to the treatment plan that helps you go forward and move into the future where that SMART goal is. Mm-hmm. So if I can just frame it up like that, those were the three things kind of come in and jive, and where you can adjust and kind of avoid some of the negative, if you will. And when I say negative, it's not finger pointing at you. It's things that obviously as a cannabis user or a cannabis medicator, you want to avoid a cannabis use disorder. So I just mean it from that light. Mm-hmm. If we can avoid those things and still propel ourselves and move forward towards our SMART goal, that's what we want to be doing.
Yes. One more thing I'd like to touch on, because it fits in with the safe use of cannabis. So 2 points on that is, where do you consume? So especially if you're inhaling, so whether it be a joint or a vaporizer, you should do that in a way, in an area that's, you're not impacting anyone else. So you can decide where that is, but as long as you keep in mind the focus is that you're not impacting anyone else that could be nearby, and perhaps even have some allergic reactions to smoke. But even without that, it's common courtesy not to do that. So, and then the other thing is, especially when it comes to edibles and gummy bears and those sorts of things, make sure that they are stored away in a safe place. So especially if there's children around or even pets, that they're not accessible and mistaken and taken. And we can all imagine what the consequences of that would be. So I see that fitting in as well. I touched on that briefly this week, is how you handle that cannabis? Where are you when you intake it, and where do you store it?
Yeah. So the thing with that in the clinic, that we often had conversations with people to the inhalation part, and if that's something that's an issue for you, this is where either a vaporizer, which greatly reduces the odor, which is what you're talking about, that could affect other people, or you're just not allowed to do based on non-smoking signs, right? But sublingual dosing or edible dosing, where it just takes the whole lung equation and inhaling out altogether. Because we do know that there's issues with inhalation, especially with the smoke, but you'll see in the low risk guidelines as well, even inhaling deeply, or they even advise against breath holding. So that big inhale and hold it. They'll advise against that. So, I mean, there's a couple of things that you can even eliminate altogether just by choosing your method of consumption to something else.
Mm-hmm. Now, Paul, I know that you always come prepared with your list of key items that you want to touch on. Is there anything that is left that we haven't touched on? If not, this might be a good time to kind of summarize today's conversation.
Summarize, I will. Cannabis is your medicine, as we said in the manifesto today. Cannabis is your medicine. It helps you. And that's great. And we're happy that you're making steps forward in your path to be well. That being said, it's still a medicine that does, THC specifically, that does affect you, alter mental status, physical coordination, things that will affect you doing things like driving, our topic today. And so it is still incumbent upon you, like if you have to use painkillers or sleeping pills or whatever, to use them responsibly. So even though it's your medicine, you still got to use it responsibly. Now, the easiest way, as opposed to getting into a conversation of how long do I have to wait or whatever, when you know you got to drive, don't mix your medicine, don't mix your dosing. And so avoid altogether the use of THC and driving when you know you're going to be dosing. I think that's the safest way. There is a ton of resources at mad.ca to kind of, we'll say, support what I just said. But, whether it's a statistic or a graph or this or that exists there, it might not be what I said, but it might be something that you read there. It's like, aha, I get it now. So please do look at that, mad.ca. There's a whole impaired driving section. The first one is cannabis and driving. If you want some more detailed information, we have a previous podcast with Andrew Murray, podcast.weedwell.com. It's episode number 9. Now, Andrew is the president and CEO of Mad Canada, and Andrew shared with us a ton of information on cannabis and driving and some of the initiatives in the background that Mad works on. Mad is currently working on and will continue to work on, and the way they develop things in a research-based manner to help propel and forward their message and what they're trying to get across to people. And it all comes really back to safe use, reduce risk, their global message, stop impaired driving, and support those that have been affected by. Finally, just with regards to what it is that you use. We know you're dosing, and if you're one that's dosing with THC, we go back to, kind of our little motto, less is more. And so the idea that you need more and more and more doesn't equate to more and more symptom relief or more pain relief, anxiety relief, or whatever. And altering your treatment plan and adjusting your treatment plan isn't necessarily more and more. It might be strain-based. It might be how you're using it or the type of cannabis that you're using. A little long-winded wrap-up, but that's kind of what we touched on. We hit a lot of points today, Mark. I think it was a really good discussion.
Yeah. I would correct you on one thing. You said long-winded. My correction would be very thorough.
Okay.
Because it has been that. So, Paul, the topic for next Thursday, I always like to look ahead because I do look forward to these, and perhaps some of our viewers feel the same way, is your medical conditions. So what can our viewers and listeners expect for next week?
So Next week is in the Be Clear section. So your ground floor, your beginning section, and it's all about gaining clarity about your medical condition. So what we've termed the health selfie, and we've always promoted an idea of getting clear about yourself before you worry about step 2 and 3 and 4. So we'll be really focusing on the ground floor and the things that go into that and how you can help yourself get a hand on the things that are happening to you.
Very good, Paul. Thanks. It's been a pleasure as always, Paul. Now it's my turn to do my wrap up. So, folks, we'd like to remind you that the information sessions, these information sessions are intended for individuals who are generally in good health, are generally well adjusted, are functioning effectively, and are not in need of medical treatment, including for mental disorders. Now, these information sessions do not involve the diagnosis or treatment of any medical or mental disorders and do not prevent, cure, or treat any mental disorders or medical disease. Further, these sessions are not a substitute for therapy, counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice or services of a medical professional. It is your responsibility to seek independent guidance from medical professionals to the extent that is necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. For those who have taken some steps in improving your quality of life, congratulations. And remember, your journey is your journey. And these steps that you're taking forward to improve your quality of life, you should be very proud of, and the progress that you're making. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So on behalf of Doug, who wasn't with us today, but Paul and myself, we always look forward to the next time that we connect. And until then, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.